wanted to ask Dr. Henry, because you touched on this a bit about the number of people who've been vaccinated already, but last week you gave us an update on how many people had allergic reactions, and I believe it was at 2, and now we're getting reports that some people have died in Norway after being vaccinated. So if you could elaborate just on what the situation is like in British Columbia as far as people having allergic reactions and whether or not there is any concern about people dying like we've seen in Norway.
Yeah, so I think Norway is a good example of something that's not unexpected when we're providing vaccination to people who are elderly and who are in long-term care. And we would expect to see that here in Canada as well, not from the vaccine, but just temporarily associated. We've not had any more reported allergic reactions that I'm aware of. What we have is a process for monitoring of adverse events following immunization, is what we call them, affectionately known as APHIs. So we do have a process where all adverse events are reported, and there's what we call a causality panel that reviews their reaction, reviews its association with the vaccine, whether it's before or after or when it arose, how the timing of it, whether it's severity. So there's definitions that we have, and we share all that information nationally as well, and Health Canada is putting out the information on the federal website. So those are things that we have had in place for other immunization programs and are stepping up for this program. As it gets more complicated, more products that are available over time and more people are immunized. It is one of those things that we do expect to see. When we're immunizing large numbers of people, and we've started with the most vulnerable and the people with medical conditions, people are still going to have heart attacks, people are still going to die from their medical conditions, from cancer, from other things, and they're still going to have car crashes and other things that lead to death after immunization. So we need to monitor that very carefully and look at if there is any causal relationship with the immunization they just received. And this will become even more critical and important as we do more mass immunization in the end of March and heading into April.